Living with cataracts is never easy. It's like seeing the world through a dirty window. Over time, the lenses in your eyes become cloudy, making images blurry and colors dull. The lenses in your eyes have a very important job. They take in light and allow you to focus your vision much like a camera lens. However, many factors from genetics to diabetes to exposure to ultraviolet light can cause your lenses to become cloudy, limiting your ability to see clearly. Don't worry, you're not alone. In fact, cataracts happen to almost everyone as they age. With so many excellent treatment options, your doctor can not only remove your cataract, he or she can potentially improve your quality of vision as well. There are many changes that happen to our eyes as we get older. Have you noticed that you have to hold a book or a newspaper farther away to read it? That you can't see things up close without reading glasses? This condition is called presbyopia. What that means is your natural lens is losing its ability to focus on near objects. Much like adjusting the focus on a camera, in a healthy eye, the lens flexes and changes shape to properly focus on objects at different distances. But as your eyes age, the lenses in your eyes lose their flexibility. The result can be diminished up-close vision. Wouldn't it be great if there was a way to correct presbyopia as well as cataracts at the same time? Well, thanks to advances in lens replacement technology, there is. Your doctor can talk to you about the different options that are right for your eyes before your procedure. Have you worn glasses or contacts for most of your life? You may be among the millions of people who have astigmatism, one of the most common forms of vision problems. In fact, 1/3 of all glasses and contact wearers have astigmatism. But what is astigmatism, and how does it affect your vision? With a healthy normal eye, the shape of the cornea is spherical, like a round globe. This allows light to pass through the lens without distortion. Light rays focus properly on your retina to provide a sharp image of what you're seeing. But with astigmatism, the cornea has more of an oblong shape, like an oval, causing light to bend and distort as it passes through the lens. This makes objects appear blurry or unfocused because light rays are not focused on one spot to provide clear vision. Your doctor may choose to treat your astigmatism at the same time as your cataract surgery. If you have astigmatism, your doctor will talk to you about the different treatment options that are right for your eyes. Cataract surgery is a straightforward outpatient procedure that's performed thousands of times every day all over the world. Through a very small incision, your doctor will use sophisticated tools and techniques to remove your natural lens that has been affected by the cataract. He or she will then replace it with a synthetic lens that will allow light to travel correctly to your retina once again so you can see clearly. While every surgical procedure has its risks, cataract surgery is one of the most common surgical procedures and is one of the safest as well. Your doctor will explain this procedure and lens options in detail and answer any questions you might have. Typically, the basic cataract replacement lens is called a monofocal lens. That means the lens only focuses at one distance. Monofocal lenses have been used successfully in many patients and may be appropriate for your needs. A basic monofocal lens will remove the cloudiness you have experienced due to your cataracts. However, standard surgery with basic monofocal lenses cannot correct for pre-existing vision problems such as presbyopia or astigmatism. And that means with a monofocal lens, if you currently wear glasses, it is highly likely that you will still depend on glasses or contacts after your surgery. See if monofocal lenses are right for you by asking your eye care provider. Cataract surgery is a very important decision. Equally important is the type of synthetic lens that you choose. Depending on your lifestyle and the anatomy of your eyes, you could choose a multifocal lens, such as the AcrySof IQ Restore lens. A multifocal lens can literally change the way you see. It allows for a range of improved vision, from near to far. Most patients who choose a multifocal lens are much less dependent on glasses or contacts, even if you've worn them your whole life. Just like it sounds, a multifocal lens has multiple focal points, allowing light to correctly focus on the retina at multiple distances. Just imagine seeing the world as it was meant to be seen and experiencing everything life has to offer, frequently without the burden and hassle of always depending on contacts or glasses. This proven technology has changed the lives of hundreds of thousands of patients just like you, restoring not only their vision, but their quality of life as well.
I'm so thankful that my doctor recommended a multifocal lens. I had such a hard time using the computer before, but now I can see the screen.
Now I can see every word in focus without having to keep up with reading glasses all the time.
I still lead an active life.
As with any surgical procedure, there are risks involved. Some patients still need glasses or contacts even after receiving AcrySof IQ Restore IOLs. With the AcrySof IQ Restore IOL, there may be a loss of sharpness of your vision that may become worse in dim light or in foggy conditions. There is also a possibility that you may have some visual effects, such as rings or circles around lights at night, or you may also have trouble seeing street signs due to bright lights or glare from oncoming headlights. Ask your eye care provider about AcrySof Restore lenses. Depending on your lifestyle and the anatomy of your eyes, your doctor has the opportunity to correct your astigmatism during your cataract surgery. One option would be to use a toric lens, such as the AcrySof IQ toric lens. A toric lens can literally change the way you see. It is specifically designed to correct for astigmatism. Their unique shape helps to minimize the imperfections in your cornea, allowing light to enter your eye with much less distortion. In fact, most patients who choose a toric lens only need glasses for up-close activities and may not have to use glasses or contacts to see fine detail at a distance, such as leaves on a tree. Just imagine seeing the world as it was meant to be seen and experiencing everything life has to offer, frequently without the constant burden and hassle of glasses for seeing things far away. This proven technology has changed the lives of hundreds of thousands of patients just like you, improving not only their vision, but their quality of life as well.
I'm so thankful that my doctor recommended a toric lens. Now I can see every play of my granddaughter's games without glasses.
I lead an active life. No more glasses getting in the way for me.
I'm not dependent on my family anymore to take me places. My independence has been given back to me.
As with any surgical procedure, there are risks involved. Some patients still need glasses or contacts even after receiving Acrosoft IQ Toric IOLs. A Toric IOL corrects astigmatism only when it is placed in the correct position in the eye. There is a possibility that an Acrosoft IQ Toric IOL could be placed incorrectly or could move within the eye. This may result in less improvement or a reduction in vision because your astigmatism has not been fully corrected, or it may cause visual symptoms. If seeing clearly at all distances is something you'd like to experience, talk to your doctor about your cataract replacement lens choices. You may want to ask questions about your vision, such as, do I have vision problems that can be corrected at the same time as my cataracts? Are there any lenses that could fix my vision problems and my cataracts at the same time? Depending on which lens I choose, is there a chance I could go without glasses most of the time? You might also want to tell your doctor what type of vision is most important to you. This could include near vision for any activities within arm's length, or distance vision for activities like driving, watching TV, or recognizing faces far away. Don't miss a moment of what life has to offer. Talk to your doctor about making a decision that will affect your vision for the rest of your life.
Cataract is a common condition that over time can often affect your vision. You may notice blurriness, poor night vision, or glare that gradually becomes worse if the cataracts are not removed. Fortunately, cataract surgery can be performed to help restore your vision. If your doctor has told you that you have a cataract, together you are the only ones who can decide if or when you should have surgery to remove the cataract. You will both make this decision based on your own vision needs, as well as any other medical considerations. When you talk with your doctor about cataract surgery, you should take as much time as you wish to make your decision before signing the informed consent forms. Just remember, as with any surgical procedure, you should have your questions answered before agreeing to have the surgery. Now, let's discuss some of the important things you should understand about cataract surgery. Usually, cataract removal is only recommended when you find it's becoming more difficult to do things like drive, read, or recognize people at a distance. As your cataract develops, you may find that adjusting your eyeglass or contact lens prescription may be all that's needed for adequate vision. It's important to remember that your eye's own natural lens, even with a slight cataract, has some distinct advantages over any man-made lens. Cataract surgery means that the cloudy natural lens of your eye is removed during an operation. The most common way of restoring vision after removing a cataract is to permanently implant a small artificial lens in the eye, called an intraocular lens. In most cases, the new lens is implanted during the cataract surgery. In rare cases, during surgery your doctor may discover a condition that could adversely affect the outcome of your surgery. If so, he or she may decide not to insert the lens implant at that time. If this is the case, your doctor will talk with you about further options. It's important to understand that while cataract surgery and calculations for lens implants are precise, they are not an exact science. To get your best vision after cataract surgery, you might also need to wear eyeglasses or contact lenses. In rare cases, an additional procedure may be helpful. Cataract surgery is a common procedure performed on millions of people each year. But as with any surgery, there are risks associated with cataract removal. Let's talk about these risks. As a result of the surgery or local anesthesia injections around the eye, it's uncommon but possible that your vision could be made worse. Complications could occur days, weeks, months, or even years later. Complications may include bleeding in the eye, infection, or elevated pressure in the eye called glaucoma. The retina could detach or swell, or the cornea could become cloudy. There's also a risk of having pieces of the cataract remain in the eye, or having the eye perforated. And there is a risk of having double vision, droopy eyelid, or an uncomfortable or painful eye. Having an artificial lens implanted in your eye carries its own risks. Complications could develop during surgery, or they could develop weeks, months, or even years later. Problems may include dislocation of the lens, increased night glare or halo, inflammation, or clouding of the cornea. There could be bleeding in the eye or elevated pressure in the eye. There is also the risk of seeing double or ghost images, or having thinning of the iris. In rare instances, lens power measurements may give results that significantly vary from what was intended, resulting in the need for corrective lenses or surgical replacement of the intraocular lens. While the outcome of the vast majority of cataract surgeries is very good, it's important to remember that the results of any type of surgery cannot be guaranteed. You may need additional treatment and/or surgery after having cataract surgery. Although it's impossible for your doctor to inform you of every potential complication that may occur with cataract surgery, he or she will aim to answer all your questions to your satisfaction.
When light passes through a clear lens, the light can focus to a point, creating a clear view. Over time, the lens becomes cloudy or opaque and develops into a cataract. When light passes through a cataract, the light gets distorted, creating a blurred view. Compared to vision with a clear lens, your vision with a cataract may look fuzzy and colors might be muted. These visual disturbances from cataracts are progressive, and when they become bothersome or limit your daily activities, it's time to consider treatment. Treatment for cataracts involves removing the cataract and replacing it with an intraocular lens implant. Many of the steps of cataract surgery that are traditionally performed using handheld tools can now be completed with a laser. Using the Catalyst Precision Laser System, your surgeon can provide you a comfortable, gentle, more accurate, and highly customized treatment. How does Catalyst work? Every eye has a unique size and shape. Prior to treatment, Catalyst scans the eye, making a precise 3D map of relevant structures. This process enables your surgeon to create a highly customized treatment plan that is tailored to your eye. How does laser cataract surgery with Catalyst compare to traditional manual surgery? In traditional cataract surgery, your surgeon uses handheld blades to create incisions in the cornea for accessing the cataract. Your surgeon will then use a surgical instrument to manually create an opening in the lens capsule that holds the cataract. The goal in these steps is to make the corneal incisions precise and the opening in the lens capsule as circular as possible, in the right location, and sized to fit the replacement lens. With Catalyst, your surgeon can use the laser to make the corneal incisions with exceptional precision. Moreover, your surgeon can create the circular opening with the exact intended size, shape, and location using the precision of the laser. Clinical studies have shown that with Catalyst, the circular opening is approximately 10 times more accurate than what is achievable by hand. With Catalyst, your surgeon can also use the laser to soften the hard cataract and segment it into manageable pieces before ever entering inside the eye with instruments. Shown here is a Catalyst laser grid pattern. The next step in both the traditional and Catalyst procedures is to remove the tissue and break up and remove the cataract. In the traditional approach, your surgeon will insert mechanical instruments into the eye and use ultrasound energy to initiate breakup of the hard cataract into pieces that are small enough to be removed. In laser cataract surgery with Catalyst, the softening of the lens by the laser enables your surgeon to remove the cataract more gently and with significantly less ultrasound energy than is used in traditional manual cataract surgery. This gentle, low-energy approach may make your visual recovery more rapid. For both traditional and Catalyst procedures, the precision of these steps sets the stage for accurate positioning of the replacement lens. And accurate positioning of the replacement lens is critical for achieving the desired visual outcome. Depending on your preoperative vision and desire for reduced dependence on glasses, your surgeon may recommend a treatment plan that could include a specific lens implant type and additional incisions in the cornea. In traditional cataract surgery, these corneal incisions are made with a handheld blade. With Catalyst, your surgeon can create these incisions exactly as intended with laser precision. What are the benefits of laser cataract surgery? With Catalyst, your surgeon can provide you with a highly customized treatment with advanced 3D imaging, a treatment with little or no discomfort, a more precise treatment, a gentler and easier cataract removal, and generally, a more rapid visual recovery. To find out more about the new standard in precision cataract surgery, ask your doctor if cataract surgery with the Catalyst Precision Laser System is right for you.